Where did the virus behind COVID-19 come from? It's a question that's dogged researchers since the early days of the pandemic. Most maintain it jumped from bats to humans in a Chinese market. Some claim it could have other origins, in particular, a breakout from a lab working with viruses. Getting answers hasn't been easy. China has been guarded, and scientists warn that the window to finding COVID's true origin is closing fast. It's a debate that has turned highly political, at times threatening to overshadow management of the pandemic itself. Solving the puzzle is still critical. Determining the origin of SARS-CoV-2 could help stop future pandemics before they start. Well, a new U.S. intelligence report also fails to settle on an origin theory, but it does give a small peek into the ongoing debate. Hello and welcome to Deutsche Welle's COVID-19 show. I'm Stephen Beardsley in Berlin. An unclassified summary of that report says outright that it's unlikely the virus was developed as a biological weapon or that Chinese officials even knew about the virus. Now, most intelligence agencies in the U.S. still think it was a transmission that occurred outside of the lab, but the report doesn't dismiss the lab accident theory, saying one agency concluded that account was more probable, while two other agencies said they couldn't reject the idea. And the report said more evidence is needed, in particular early clinical samples of the virus. But that appears unlikely to happen, and it means the debate over origin will continue.
The Wuhan Institute of Virology, one of China's leading coronavirus research facilities. Several staff here reportedly fell ill with influenza-like symptoms weeks before the first known outbreak of COVID-19 in the same city. But in early 2021, a World Health Organization fact-finding team dismissed the idea that the virus could have leaked from a laboratory.
The findings suggest that the laboratory incident hypothesis is extremely unlikely and to explain the introduction of the virus into the human population.
Instead, the WHO team concluded COVID-19 most likely originated in bats and was passed to humans via another animal. But some weren't convinced. A group of volunteer researchers called Drastic dug into the data. Drastic team members say they found documents showing the Wuhan Institute was collecting and storing bat viruses, including the closest known relative to COVID-19. And that scientists here were experimenting to make viruses more infectious while using inadequate safety standards.
We know from all of the records, from the NIH grant applications, from papers published by the Wuhan Institute of Virology experts, that they were engaged in aggressive research and aggressive work that was making scary pathogenic viruses scarier.
With suspicion mounting, in May, US President Joe Biden ordered a new investigation into the Wuhan lab leak theory. China rejects the claim and points the finger at the US. The US, in order to shift responsibility for its poor COVID-19 response and achieve the political motive of smearing and suppressing other countries, has pursued politicization and stigmatization and used origin tracing as a tool. Just like the virus, debate over COVID-19's origins continues to mutate and proliferate.
Now, one thing about the virus origin is clear. It came from an animal. And that leap from animal to human appears to be happening more frequently. Ebola, Zika, swine flu, all familiar viruses in recent years, all originating from animal species, either domesticated or wild. The common thread is the increasingly thin separation between animal habitat and humans, something that environmental scientists say is only getting worse as important ecosystems disappear. Well, Naveen Kumar Arora is Dean of the Department of Environmental Sciences at Babasaheb Bhimrao Ambedkar University in Lucknow, India. Naveen, welcome to the show. What do you make of this origins debate, if I can ask you up front?
Yeah, you see, this origin debate will go on, but the thing is that 70% of the viruses or even other microorganisms which are pathogens are zoonotic in nature. This is the report of World Health Organization. So most probably this virus has also, this is the most accepted theory, that this virus has also jumped from the animals, the wild animals, to the humans.
Can we definitively say that this animal to human jump is happening more frequently?
Yes, it is happening because, the human-animal conflicts are increasing, and we are also the bushmeat trade, the unorganized livestock sector throughout the world. These all are the reasons, apart from deforestation and fragmentation of habitats, climate change. All these are reasons which are causing more the interactions of wild animals with humans, and the chances are increasing.
What can we really do to prevent future pandemics if habitat loss and climate change, for example, are going to drive future infectious diseases? It seems like we're just going to have to live with this.
Yes, we have to go for environmental sustainability. Sustainable Development Goals were announced in 2015, but as per the Secretary General of United Nations, we are not going to achieve those targets by 2030 for the stipulated time for achieving the Sustainable Development Goals. The way things are moving, the way temperature is increasing of our planet, we can see the disasters, the natural disasters. This one is a biological disaster. So these disasters are going to increase if we do not mend our ways, if we do not go for environmental sustainability, if we do not make our ecosystems robust, our biodiversity robust.
You mentioned there, Naveen, the Sustainable Development Goals of the UN. Do you think that politicians and the public understand this idea of the animal to human leap thanks to what's happened with COVID? Is this something that now, is this a message that they've gotten?
At present, the population, the general public is more concerned about the virus, how to save themselves, rather than focusing on how the breach means, how the virus has transmitted from animals to humans, how these are zoonotic microorganisms which are causing havoc. So the focus at present of the governments and of the general public is rather than on the survival, rather than on how to save themselves, rather than to save the environment. Yes, there are reports, there are news, there are researches which show that environmental sustainability is much more important. So we have to wait and see once this virus subsides, once this pandemic is gone or it subsides into a regular virus, then we have to wait and see that how the public reaction will be. At present, we are saying that environment is making a comeback and all those type of things, but it has to be a sustainable thing, means it has to sustain for several years if you want to get reality into the environmental sustainability.
In the near term, Naveen, is this changing the way, at least, that we look for viruses?
Yes. Yes, it is changing. Means we have to look for the surveillance has to be better. We have to look for how these viruses arrive into the human ecosystem, into the human population. We have to be more vigilant. We have to be vigilant about the mutants. What I want to suggest here is we have to tackle the environmental pandemic rather than this COVID-19. Yes, we will conquer COVID-19 one day or other, but we have to tackle the environmental pandemic which is raging since last several decades.
All right, we'll have to leave it there. Naveen Kumar Arora with Babasaheb Bhimrao Ambedkar University in Lucknow, India. Thank you so much.
Thank you. Thank you.
It's time now for one of your questions. Over to our science correspondent, Derek Williams.
Will vaccine shortages in some countries create new variants?
Another million-dollar question where yes is a possible or maybe even a likely answer, but not a certain one. That's because SARS-CoV-2's genome mutates all the time during replication, but only very rarely do those mutations come together in really dangerous ways in new variants that have clear advantages over earlier incarnations of the virus. Don't forget, there have been well over 200 million confirmed cases of the disease so far worldwide. And healthcare authorities think many, many more have gone unrecorded. Yet the WHO has still only identified 4 variants of concern and 4 variants of interest. The virus has therefore shown that it can change for the worse, for example, by becoming a lot more transmissible, like the Delta variant. And it certainly has the potential to evolve in even more worrisome directions. But based on what we've seen so far, a lot of experts don't expect that to happen really suddenly. But what should be clear is that the even more worrisome scenario becomes more likely as more people are infected. To some extent, it's a numbers game. And the more possibilities we give the virus to replicate, the higher the chances that it will eventually mutate into a pathogen that, for instance, is much better at evading immune responses in people who've been vaccinated or people who've recovered. The best way to keep that from happening is to vaccinate as many people as possible, as widely as possible, because the evidence indicates that even if they get COVID-19 anyway, vaccinated people are less infectious than unvaccinated people, which means vaccinations can help stop transmission chains, which is the point. So I wouldn't say that vaccine shortages in some countries will directly create new variants, but they do provide a setting where new variants are more likely to arise.